Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder, and this is BRN AM for Monday, March 15th, 2021. And our top stories today, the impact of heart disease on the mature and the young, and the steps you can take to prevent heart disease. Joining me now to discuss this and a lot more, Dr. Michael Blaha is a professor of medicine at Johns Hopkins Medicine. Dr. Blaha, it's great to see you. Michael, thanks for joining us this morning.
Yeah, it's my pleasure to be here.
Yeah, well, look, this is such an important topic, and it's not just, when I was a young man, I always thought that heart disease and prevention of heart disease was something that I got to, but I would have to think about in my mid-40s and my 50s, what I considered to be old. Now that I'm in my mid-40s and close to 50, I don't think that's old, but you also need to be thinking about prevention of heart disease earlier as a younger person.
That's absolutely right. The evidence suggests that risk factor control and healthy lifestyle choices actually matter more earlier in life than they do later in life. And that's probably because of the long time to accrue the benefit. We know that cholesterol levels that are healthy earlier in life are better even than having high normal cholesterol later. Healthy blood pressure earlier in life better, and also lifestyle changes. The healthy weight, healthy eating habits. Not only do they form that habit throughout your life, but they mean more. They predict good outcomes better earlier in life than they do later in life.
And I should have added that you were the director of the of clinical research at the Ciccarone Prevention of Cardiovascular Disease. Is it more about lifestyle changes? And when I say lifestyle changes, it's about controlling things that you can control, diet, exercise, but that doesn't mean that you have to restrict some of these things, right? It's just about controlling, minimizing, doing the things that you need to do so that down the road, you don't have health issues. And by the way, those health issues can really add up in terms of expense.
Yeah, absolutely. The most cost-effective way to control cardiovascular disease by far is lifestyle. This has been shown time and time again. But of course, if your cardiovascular disease gets advanced, you have to be on medicines and sometimes get procedures. But earlier on, you can manage your risk with lifestyle. So by far, on a population basis, lifestyle is the way to go. And absolutely, we always start with lifestyle. Hopefully, you're starting before someone even has the manifestation of cardiovascular disease and is adopting a healthy lifestyle to maintain kind of their health throughout their life. Now, of course, there is times when lifestyle kind of has its limits and we need to start medicines, for example, but we always start with lifestyle first. So the question is, can lifestyle control this? In many cases, it can, but of course, when you see your doctor and you watch your risk factors over time, sometimes you need medicines to assist with that. But if we do it right, and the combination of lifestyle and preventive medications, we can prevent the costly outcomes like heart attack, stroke, stents, bypass surgery that some of our patients, unfortunately, experience later on in life. And
it's my understanding, and correct me if I'm wrong, we have seen an increase in risk, even among people who are younger. I mean, 22 years old, 24 years old, 25 years old. Is that correct? And also, what's the impact of the pandemic besides the obvious? I mean, we know that people got COVID, they maybe got sick. Hopefully, they didn't pass away. But what has been the impact of COVID on the increase or decrease of cardiovascular disease?
Yeah, very, very good question. Very complicated, but I'll take the first part first. We do have actually over the last 3 decades, a marked decrease in cardiovascular disease in this country, which has been a great success. And some of the low-hanging fruit, of course, was getting people to stop smoking, reducing trans fats in the diet, reducing salt intake, things like that. But unfortunately, we have hit a plateau, unfortunately. Over the last several years, cardiovascular disease rates have plateaued, if not increased a little bit. This is likely attributable to things like obesity and diabetes becoming the new replacements of things like smoking in the past. And there has been an uptick in premature disease in young people. And there's various hypotheses about this, but this could be everything from opiates, other poor lifestyle choices in young people, including stress, things like that. So yeah, there's unfortunately some signs that we might be reversing our trends, and COVID adds a lot of complexity to this. we've done some research on this and trying to track people's lifestyle. In fact, we use actually Google tools to try to track people's lifestyle choices during COVID. And unfortunately, what we're seeing is sort of a bimodal distribution. Certain people, groups of people had their lifestyle improve. Maybe their stress reduced, maybe their eating could improve during COVID. But then there's a good host of people whose state of mind, unfortunately, was probably more depressed, who are walking and moving a lot less, staying in their home, who are likely to unfortunately down the road experience more cardiovascular disease. So I think it's going to be a very complicated thing to work through, but I think there's going to be a good number of people, unfortunately, that are going to be at risk for cardiovascular disease because of things like physical inactivity, stress during COVID.
Yeah, I mean, certainly that stress level up. I know I personally have felt a lot of stress just given, you watch it on TV, you're locked into a house or an apartment or wherever you're living. The mental anguish that you feel from lack of seeing people. On top of that, being sedentary. I haven't been working out as much, and I'm not making the show about me, but I'm just relative to, I was a rower, an active rower. I haven't rowed as much. I haven't been taking walks. The impact here, I think, as you suggest, is that we're not going to know tomorrow, 6 months from now. We're going to see this in future studies that you and other clinicians do around the globe, really, on what this long-term impact of COVID would be.
That's right. Yeah. So there's some interesting studies about things like, do people go to the emergency room less or more during COVID because of fear of COVID? Those are the immediate term effects, but the long-term effects aren't as clear. And I'm worried in particular about people who, for example, made a habit of going to the gym. For example, that was how they worked out. And all of a sudden they couldn't go to the gym. I have a lot of patients like this, and they say they haven't exercised much at all. Now, on the flip side, of course, there's the people who have a Peloton or something like that at home who've thrived in this setting. So it's just like a lot of outcomes, education outcomes, financial outcomes, healthcare outcomes are going to be very inequitable after COVID, I think, and we're going to have to understand that a lot more. But of course, I'm most concerned, like the patients you mentioned, you mentioned, who really have been sedentary during this time, maybe have been stress eating during this time, sleeping poorly during this time. We know those are risk factors for heart disease. So it's very interesting and very complicated times. And you're right, we're going to need a lot of good, high quality studies to figure this out. There's no way to know yet.
Yeah. And we're going to, I think, just raising awareness, very important here. Doctor, I want to take a very quick break, but when we come back, we'll talk to Dr. Blaha about prevention and things that you can control to eliminate possible heart disease, including nutrition. So you're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're talking to Dr. Michael Blaha of Johns Hopkins Medicine. Dr. Blaha, thank you so much for staying with us this morning.
Yeah, my pleasure to keep chatting.
Yeah, this is great. I think what we're doing here, or basically you're doing, I'm not doing anything, but we are raising awareness about this important issue. And it's not something that you can just put your head in the sand if you're like an ostrich and not think about if you're 22 years old, because this has ramifications not only on how long you're going to live and when, you know, what that lifespan is going to be, but also potentially on your finances. Healthcare costs are going up. I know you know this, right? I mean, you're in the field. Healthcare costs are going up, so it's really important to kind of nip this in the bud.
Yeah, absolutely. So much of our field is based on not only how long you live, but how well you live and how efficiently you live in terms of your use of the healthcare system. And there's no doubt once patients have an overt cardiovascular disease, they've had heart attacks or strokes, the costs just keep accruing, right? The medicines get more expensive, the interventions get more permanent. So absolutely, the earlier you can think about these kind of things and control your life, the better you're going to live. But it's going to have an impact on your pocketbook and your need to experience healthcare. So absolutely, I make this case with my patients, and they sort of get it as they're getting into our age, that they want to live for a long time, but free of taking a lot of medicines or free of a lot of healthcare visits or hospitalizations. Absolutely.
Are there certain, when you look at the population and you're a clinician, you're doing a lot of research at the Chickaroni Prevention Center, are there certain elements of our population that are more vulnerable than others to this horrific disease? Forgetting obesity, forgetting diabetes and some of the other maladies. In particular this, are there more vulnerable populations that we really need to be focused on with education and preventative measures?
Absolutely. And on a couple different angles here. First of all, of course, there's inequities in this country in terms of access to care, knowledge about preventive therapies and access to preventative resources. So absolutely, we see, unfortunately, still a good swath of the population present for the first time for healthcare with, cardiovascular symptoms. And that's too late. Of course, we need to be engaging with them earlier to try to prevent the disease. So a lot of inequities there in terms of outcomes, unfortunately. And then we have a swath of patients who do quite well with their outcomes, who are kind of very preventative minded and starting with a lifestyle change early. So we know it works. So that's true. Another area I think we need to really emphasize more in this country as we've improved kind of overall health is certain young people who are particularly high risk, right? These can be people with strong family history or very high cholesterol at young age, very high blood pressure at young age, early onset of diabetes. Sometimes this can be due to lifestyle, but sometimes this can be pre-programmed, based on a family history, for example. So it's amazing how many people in this country, for the first time, find out their cholesterol is dangerously high in middle age. For example, just managed to not know they had very high cholesterol, something we call familial hypercholesterolemia, a genetic condition. So we don't want to miss these people who have extraordinarily high risk early in life. And this can just be simple screening, check your cholesterol, check your blood pressure, just to pick up the outliers. So we need to both balance out the outcomes across socioeconomic groups and things. We also need to make sure that we're finding the really high risk patients who we just really shouldn't be missing in this day and age.
And you said it. I mean, if you're younger, you should get those screenings. You should go to your healthcare provider, get a physical, check your weight, do all the vitals, it doesn't take that long, and it's just a little pinprick for blood. You're gonna be okay. But the information that you gather from that you can track over time gives you a better sense for what you're predisposed to, but also what your treatment plan could be. Am I right about that?
Yeah, absolutely. So just taking, for example, cholesterol levels. I mean, many of us have kind of average cholesterol levels, but there's a segment of the population that have very high cholesterol levels, and it's completely treatable. But we need to know that the cholesterol is elevated. So it's amazing how many people, I talk to in their 50s, for example, and say, what's your cholesterol? They don't know, and I just hope that it's not really high for life. It's different if you have high cholesterol throughout your whole life or if you develop it kind of at later age. So it's important to, as we talked about earlier in the segment, to intervene earlier if you have those risk factors, including also a family history. Yeah, so just simple things like know your cholesterol level, know your blood pressure, know your family history as well. Communicate that to a healthcare provider when you see them. These are pretty simple things that actually can have a pretty big impact.
And by the way, even if you're covered under the Affordable Care Act or some other type of insurance, generally an annual physical is covered. I mean, these preventative things are covered, and so people should consider doing them. It doesn't take that long, and I'm afraid of needles, but I go anyway. Last question, doctor. Is there any correlation? Is it equal 50-50 in terms of diet and exercise? Like, can you get away with having a good nutrition, but maybe just exercising 1, 2, 3 times per week? Or is it really, as you were describing, a full frontal, doing multiple things at once to ensure, you've got the preventative medicine, but you're also doing the diet, and you're also exercising, whether it's a long walk, whether it's doing pull-ups or push-ups or getting on the rowing machine or the Peloton?
Great points. Yeah, I'll make 2 points about that. Number one, I would say that really they're both important, of course, but they tend to go hand in hand, I find. People who tend to exercise more tend to eat better, and people who tend to fall off the wagon and eat poorly and stop exercising. So they kind of go hand in hand. I don't see as much instances where the diet's really bad, but the exercise is good. So I think they come as a lifestyle package, right? As soon as you start thinking of yourself as I want to be a healthy person, I want to be mindful about my health, I think they sort of go together. But which one's more important? I mean, it really depends on what we're talking about, because of course these things are good not only for cardiovascular health, but your bones and your joints, long-term, dementia outcomes, things like that. So really they're both important. What I would say, generally speaking, diet is a little bit more important for your weight, I would say. Exercise is a little bit more important for of course, your fitness level and your ability to withstand kind of, let's say, like a COVID illness, for example, or another illness. So they're both important, but in slightly different ways. And maybe, exercise is a little bit more important of the long term for like musculoskeletal health, for example. But really, I think of them as sort of going hand in hand. When I start exercising personally more, I eat better. And when I look back, when I exercise less, I eat less well. And it's probably a stress thing or something has gotten me off my pattern. But I'll make one more point about exercise. Then people start to separate also exercise and physical activity. I like to make a distinction there. So what we've also found is that, it's not only people who exercise have the best outcomes, but people who exercise and are physically active. And let me make a distinction there. So some of us sit in a desk the entire day, right? And then exercise either in the morning or at night. That's okay, but even better is being physically active throughout the day and exercising. So we know people who are physically active but don't exercise have somewhat better outcomes. We know if you aren't physically active and you exercise, you have better outcomes. But the people who have by far the best outcomes are physically active and exercise. What do I mean by that? They don't sit in a desk and get 1,000 steps and then run a 5K. They're physically active throughout the day. They take walking meetings or breaks. They walk the stairs, et cetera, and they exercise. So think of that as not just exercise, but physical activity. Make sure you get that and you get exercise. That's a distinction I make that I think resonates with a lot of people. So all these things are very important.
Yep. Sorry, I didn't mean to interrupt you. I was going to say it makes a lot of sense, and you've inspired me. I'm actually standing up as we're talking at my little desk, and I do that most of the day, but you've inspired me to go maybe do a couple rows a day, maybe do some pull-ups, some push-ups. I could use some fitness. Dr. Blaha, it's a pleasure talking with you. Thank you so much for sharing your insight and your perspective today, and we look forward to having you back on the program again very soon.
Yeah, my pleasure. Have a great day.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, then drop us a line. And don't forget, for all the information in retirement, markets, technology, personal finance, so much more, all in one place, check out our daily newsletter and our website. We're back again tomorrow, so until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Waiting here for you to take and drink of. But if you're tired, for the same.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.